While the Center for Medical Imaging continues to use X-rays to screen for lung cancers, new efforts are focusing on CT scans. Dr. Jeffery Brabham, radiation oncologist with Florida Hospital Waterman, explains what the future of lung cancer screening could look like.
It's been theorized over many years that screening for lung cancer, i.e. looking for it earlier with X-rays of some sort, would lead to earlier detection and better outcomes, ultimately earlier survival in patients who have a history of smoking and are at risk to get lung cancer. It took a surprisingly long time to generate a study that really proved that. Partially because chest X-rays were not the best way to look for these things because they're relatively imprecise. But relatively recently, within the last year or so, a major study was done using CT scans, which is a more advanced imaging technology that gives us a better look at the lungs. And with this study, with longer follow-up, it has finally proven that there is a role for screening for lung cancers in these high-risk patients. We expect to see the lung cancer rates hopefully decline with time. Of course, there's no substitute for getting people to quit smoking. That would be the ultimate driver of that. I've seen so many patients' lives destroyed by the effects of smoking, and also so many families who lose loved ones way earlier than they need to.
It's important to note that the use of CT scans for lung cancer is currently not covered by insurance and is available only for former and current heavy smokers aged 55 to 74. To learn more about whether you are a candidate for lung CT scan at the Center for Medical Imaging, please click the Lung Scan Story link on our homepage, yourhometownhealth.com.